I thank you again for having me, and I hope you learn a little bit here. Honestly, Tourette syndrome is the basis of all the other disorders that I have treated. Okay? All those ones that you saw me do early in the morning, all that came from knowing this. And then I had to literally think outside the box. When I first did this, there was a gentleman at a friend of mine's church. He had Tourette's. You'll see him. He had Tourette's really, really bad. And the pastor asked me, do you think it can help him? I said, I don't know. So I said, bring him by on a Friday afternoon when I'm not working, and we'll test him out. We tested him out, and boom, he instantly stopped. I mean, instantly stopped. And he had one of the most severe cases that you've ever seen. I mean, in church, he's swinging his arms and coughing and the whole 9 yards. And I said, I have to know what I did, because I didn't know what I did. I'm being honest with you. I didn't know what I did. So it took me about 6 months. You know, I'm going on what the medical society has said Tourette's comes from. And I'm literally in the medical library at University of Maryland every single day. And, you know, I'm looking at the stuff, and I'm going, this does not make sense. This does not make sense. This does not connect. Where, you know, what is the problem? So I said, change. Look at something different. Look at what my nerve does. The nerve and once I did that, boom, everything just opened up. It was like, you can see this, you can see that, you can see this, you can see that. It's called knowledge, wisdom, and understanding. Not everyone who has knowledge is wise. That's why I keep saying that. Not everybody who has knowledge is wise. And I tell everybody, I love my wife. And the reason why is because even though, you know, the first 6 months I did this, I kept looking. It literally took me 1.5 years to find everything. And I was at the library every single day of the week for 1.5 years, trying to find the answer to what happened, why this works, why this didn't work, why. And I tell everybody I love my wife because my wife could have accused me of having an affair with the librarian, because I was there, I mean, till 10 o'clock at night, and then go home, then go to work, and then leave work, go to the library. It's just a matter of being determined to find the answer. Non-toxic way of treating Tourette syndrome. Tourette syndrome is a neurological disorder characterized by repetitive, stereotyped, involuntary movements and vocalizations called tics. Tics are classified as either simple or complex. Usually starts between 3 and 18, 4% of children, and it can be transient or chronic. Simple tics, we saw these slides this morning. Eye blinking, facial grimacing, shoulder shrugging, head or shoulder jerking, vocalizations or clearing throat, sniffling and grunting. Let me ask you a question. How many here have ever had a movement disorder? All right. Now, we talked about this, right? What's the first thing you have to do when you sneeze or have a sternutation moment? What's the first thing you have to do? Something you have to do. Huh? All these answers are good answers. Raise your hand, girlfriend. You close your eyes. You cannot sneeze and not blink. It's impossible. Now, all of you are going to go home and try and do it. You're going to go. That's the way you're going to look, but you can't do it. It's impossible. Okay? The second thing you do, okay, is what do? You make a facial grimace. Don't you go like this? Right? Right? Facial grimace. Second thing. Third thing. Do you shake your head? How many shake their head when they sneeze? That's why I was laughing at you, the ladies this morning. They want to go, right? They want to try and be all nice. Us guys, show them how it's done. Right? Shoulder shrugging. You shrug your shoulders when you do that. And the other thing you do when you sneeze, what's the last one? You make a sound. You cannot sneeze and not make a sound, right? Notice all the signs of Tourette syndrome: eye blinking, facial grimacing, shoulder shrugging, head jerking, vocalizations. What's the other thing that happens when you sneeze? You know it's coming. How many know it's coming when they're going to have a sneeze? Ah, ah, ah. And after you sneeze, what happens? You feel better. Right? That is due to how many nerves? One nerve. So you have complex tics, facial grimacing, head twisting, sniffling and touching, hopping, jumping, echolalia. Echolalia means I say something, you say it back. That's one of the things. Now, the hard one is when you hear the coprolalia. Now, everybody knows what the coprolalia kids do. They're like cussing you out, basically. And then the ones that are self-injurious. Tics, you have that, they have the urge. Tourette syndrome, the kids have an urge. They know it's coming. And after they tick, they feel better. Right? That's what it is. They call it a premonitory urge. It's just the same thing as a sneeze. It's associated with attention deficit hyperactive disorder, which is inattention, hyperactivity, impulsivity, problems with reading, writing, arithmetic, obsessive compulsive disorder, such as intuitive thoughts, worries, and repetitive behaviors. These are the patients that leave the room, turn the light out, close the door, open the door, check to make sure the light's out. Close the door, open the door, check to make the lights out. The lights are out. That's what obsessive compulsive disorder is. Make sure the bed corners are always tucked in. Did I do it right? Make sure the bed corners are tucked in. That's what happens. Let's look at possible pathophysiology. There are no blood tests for Tourette syndrome. There are no laboratory tests, no imaging tests for the diagnosis of Tourette syndrome. They take MRIs. Every MRI of the brain for those who have Tourette syndrome usually looks fine. Like 99.99% look fine. We always take one just to make sure that there is no problems. EEGs, no EEG studies, no computer tomography, CT scans. Blood tests are done to rule out all the other stuff just to make sure there's no problem. And 99.999% of the time, they have no problem. Medications. This is the tough one. Okay? They give medications. The medications these kids take are neuroleptics. They give them ORAP, diazepams, diazepines. They give them clonidine. They give them Ritalin. They give them all kinds of drugs. The kids come in, and the kids are like, the mom says, my kid is not the same kid because of all the drugs that he's taken. He has been on every drug, and he's a zombie. He can't study in class. He can't stay awake. Can't do anything. Side effects: sedation, weight gain. Okay, gynecomastia. What is it? Gynecomastia, where men develop breasts. Okay, that's what happens to the kids. The kids are 90 pounds and they go up to 150 pounds, and the young men have breasts. Tremors, dystonic reactions, twisting, Parkinsonian like symptoms, dyskinesias, tardive dyskinesia. One of the neuroleptics, if given over a long time, makes the kids stick their tongue out and can become permanent. So what they're doing is they're like this all day long. How would you like your kid to go to school looking like that? Don't think so. Cognitive behavior. This is their way of doing a non-toxic way of treating Tourette syndrome. What this is, training to voluntarily move in a response to a premonitory urge that can reduce tic symptoms. All they're telling you is mind over matter. Okay, that's all it's saying. Okay, if I have an urge to move this hand up like this, they say don't think like that. Put your hand in your pocket and do this. What the? Okay, it doesn't work. It doesn't work for 5-year-olds. The urge is still there. The tic is still there. They cannot, for 5, 6, 7-year-olds, they can't comprehend that. Maybe at 25, 26, they can do it. But a 5-year-old, they can't do that. That's their way of doing it. It's called Cognitive Behavioral Intervention for Tics, CBIT. It says it reduces the symptoms by 40%. Yeah, including, and this is what they don't tell you, including the medication that goes along with it. That's 40%. Now, the other way is called deep brain stimulation surgery. Anybody know what deep brain stimulation surgery is? Okay. Your kid has tics and Tourette's. Let's say it's the very bad type. What they do is they put wires into your kid's brain. 2 wires into the brain, into an area called the subthalamic nucleus. And then they run the wire, as you see, up under the skull, along the neck, down into his chest, and then they attach a battery pack to his chest. Okay? And then the battery pack is like a radio tuner. They do this first. 2 weeks later, they put this, they call it a neurostimulator. It's a radio transmitter. Don't lie. Don't let them lie to you. It's a radio tuner because they have to tune it to see if they can get it to, get those tics to decrease. Now, and then 2 weeks later, they turn it on, and hopefully, cross their fingers, it goes down. It's less than 40% effective also. And guess what they have to use in addition? Medication. So, it's not suggested for kids under 16, only for the intractable or the really bad cases. Continuous use of medications, quality of life versus risk factor. I wish I could tell you how many kids I've had who've had them and come back and said, it's not working. According to the CDC, according to the NIH, according to Mayo Clinic, there is officially no cure for Tourette's, generally lifelong and chronic. It's not degenerative. Normal life expectancy in TDS does not impair intelligence. Etiology. The official cause of Tourette syndrome is not known. But if you understand how a nerve can be compressed and irritated, you might be able to be on something. 2 events have shown that 90% of the cases in Tourette's, the auriculotemporal nerve. How many know where the auriculotemporal nerve is? It's the back of the jaw, right between your ear and your jaw, where you articulate the nerve. And what happens is you will have distalization of the mandible. You will find that most kids with Tourette's have a retracted jaw, lower jaw, or their upper jaw has not grown. So it cannot grow. If it cannot grow, which way is the growth epiphyseal? In the back. Which way is it going to grow? Backward. Where's the nerve? Back there. So what are we looking at? We look at the auriculotemporal nerve behind the condyle of the mandible. When that is compressed because of an entrapped mandible, the mandible cannot go forward. It can only go backward. If it goes backward, it presses on the auriculotemporal nerve. The auriculotemporal nerve is part of what nerve? Trigeminal. What nerve causes all the symptoms of sneezing? What nerve causes the head shaking, the shoulder shaking, and all the symptoms? It is part of which nerve? How many parts of a trigeminal? What's the first division? Second? Third? Mandible. Okay. The sneeze is here, right? Still the maxilla, it's still the trigeminal nerve. But when you sneeze, you're able to get everything out when you sneeze. But if your jaw is set back, you can't get rid of that. That nerve is constantly being irritated. Constant irritation causes sneeze-like symptoms. Sneeze-like symptoms sound just like tics, Tourette's. So your jaw grows backward, compressing the nerve. Your jaw grows backward, compressing the nerve. You take an MRI. The jaw is here. And you want to eliminate tics? The jaw is there. Tics are possibly due to an interaction in the subnucleus caudalis. Okay? This is the neurology part. Cranial nerve 7 interacts with cranial nerve 5 in the subnucleus caudalis. Cranial nerve 9, which causes the coughing and the spitting tics. Cranial nerve 10, which is the vagus nerve, causes the vocal tics and the abdominal tics to happen. All those are connected in the subnucleus caudalis, where the blue lines are. 5, 7, 9, and 10. Constant irritation of the trigeminal nerve causes the auriculotemporal nerve to be constant firing in the brain stem and constant release of serotonin. Constant serotonin release results in incomplete recovery of the reticular formation neurons, which contains the serotonin. That is like we have Hoover Dam, okay? And what they do is the neuroleptics that they give are like Hoover Dam is leaking, but they get a bucket and throw it back in, and throw it back in, and throw it back in. Okay? You got the door open in Hoover Dam. What's the best way to fix that? If it's leaking, fix the leak. Close the door. Right? And irritation means it's constantly releasing the serotonin. Constant release of serotonin means you got to put it back. What if you just close the door or stop the leak, what's going to happen? Serotonin builds back up. Normalized neurochemicals. Because there is a decrease in dopamine within the brain, it is believed that there is a basal ganglia dysfunction when it may be that the dysfunction is in the reticular formation or in the brainstem release of serotonin. This is the neurology part, or the chemical part. When they look at Tourette syndrome, they look at dopamine. Dopamine comes from the basal ganglia. But the problem is dopamine is regulated by serotonin. So the more serotonin you have, the less the dopamine. The less serotonin you have, the more dopamine. They look at the dopamine. Serotonin comes from the brainstem. Do we know of any nerve that goes directly to the brainstem? Who said that? Who said that? I like her already. The trigeminal. If we have one neuron that is damaged, how many neurons can it affect? 1,000, 10,000. So if one neuron in the trigeminal is damaged or irritated, constant irritation releases the serotonin. Serotonin cannot recover, so the serotonin is low. What happens to the dopamine? Dopamine is high. What do they look at? They look at the dopamine. So what do? They give levodopa. They give them all these different medications. Now they're looking at selective serotonin reuptake inhibitors. So everywhere that in the brain that dopamine is, the serotonin goes to. Serotonin is the area that is the neurochemical that controls the dopamine. But also, this is a part of the brainstem. What nerve do you see? Trigeminal nerve. Trigeminal nerve goes to what is called the locus coeruleus. Locus coeruleus is the area that controls noradrenaline, adrenaline, basically. Okay. What do ADH kids have a lot of? Huh? Hyperactivity. What's the hyperactivity caused by? Increased adrenaline. There's more adrenaline left in their system. Do we know of a nerve that goes to the brainstem's locus coeruleus? I ain't got to tell you. You can figure this out. What nerve? All right. When there's an imbalance in serotonin, there's an increase in OCD. So when you have low serotonin, high dopamine. Low serotonin, increase OCD. Obsessive compulsive disorder. So if we shut the door or control the leak or stop the leak for the serotonin, what's going to happen? The serotonin is going to go back to its normal levels. What's going to happen to the dopamine? What's going to happen to the OCD? There's an imbalance in norepinephrine. So if we correct the locus coeruleus neuroadrenaline, it goes down. What happens to it goes back to its normal level, what happens to the ADHD? Goes down also. Correction of the facial anomaly by decompression of the nerve allows the irritation to discontinue and therefore reducing and or eliminating the tics disorder or Tourette syndrome. Here are some cases. MRIs of cases. All right? This kid here, JB, had 105 tics in 3 minutes. We decompressed his jaw and decompressed his joint. He was down to 4 tics in 3 minutes. What do you think the parents said? This kid, BH, had 15 tics in 3 minutes, down to 2 tics in 3 minutes. Decompression of his jaw. DB had 58 tics, down to 15. This was one of my favorites. 60 down to 2. He was almost still. Now, if I just showed you this with and had no numbers, you wouldn't think that there was a difference in those who had Tourette's. You have to understand knowledge, wisdom, and understanding. Know what to do. Correction with an oral orthotic. They have it's called the Yale Global Tic Severity Scale. What it does is just measures all the different things that happen with Tourette's. You know, the head shaking, the movement disorders, the ADHD, OCD, all these things. We did 91 cases, okay? And we asked the parents, what have you seen? Simple tics went down by 87% versus 40% with their CBIT versus less than 40% with their deep brain stimulation surgery. The parents are telling me 87% reduced. The complex tics, 82% reduced. The internal tics, the breathing tics, down 95%, all without medication or surgery. Which would you rather have? Medication or the oral orthotic? Yeah, that's right. Here's a young lady. This young lady, I met the mother in England. They had a symposium over there, okay? And the mother was from Japan. And I had a little chart showing all these things. And the mother came up to me and said, "You can get rid of Tourette's." Yes. You sure you can get rid of? Yes. Are you really positive you can get rid of Tourette's? Yes. Can you help my daughter? Probably. She went and got her husband, who was a physician, a psychiatrist, who was the one that was giving the medication to the daughter. You can get rid of Tourette's. Yeah. You can get rid of Tourette's. Yeah. All right, we're going to send our daughter to you from Japan. This is her.
This is my daughter, Nonoka. She's 17 years old with OCD. And since she is 6 years old.
6 years old? Okay.
Sometimes she studies taking medication from psychiatrist. She's been taking Fluvox for more than 10 years.
10 years, okay. Okay. And where are you from?
Oh, I'm sorry. We are from Japan.
Okay.
Yes.
And how did you hear about us?
Well, I met Dr. Sims in London at a conference, and so we are here now.
Okay. And what are her symptoms besides the vocals?
Well, besides vocal tics, she has motor tics. Any kind of motor tics. Shaking, yes, like this, shaking head, shoulders, legs. Yeah, any kind of symptoms.
Okay.
Yeah,
all
it
symptoms.
depends on the period.
Okay.
Right?
Okay. All right. Ready?
Okay.
Go ahead and put it in.
衝動と症状が少なくなって楽です。She feels her urge reduce, getting lower.
Urge is going down? Is that what you...
And symptoms.
Symptoms?
Also going down.
Going down.
And 息がしやすい. And they feel easy to breathe.
Easier to breathe? Good. Hey, what else? I don't see you moving.
Yes, no, doesn't need to move.
The urge to move is...
She feels very much better.
Much better.
Yes.
How about relax?
Yes, a lot. Very much.
Very much.
Very much relaxing.
Good. Very good. What would you say to other people about this?
他の方にこの治療を今やってるこれについてどんなふうにお伝えしたい？衝動がないから楽になるし、息もしやすいし、普通の人になった感じ。She says she feels much easier with the reduced the urge.
The urge is reduced, yes.
And much air she can take. Easier breathing.
Easier breathing.
And she feels, like she could finally become like a normal.
Oh, that's nice. Nice. She feels like you can become normal.
Yes.
Very nice. I like it. Do you like it?
Yes.
Good.
Great.
Great.
Thank you.
That is absolutely great. I love it. Love every minute of that.
Thank you.
Do I get a thumbs up? Thank you so much.
Thank you.
Anyway, let's answer some of the CDC questions. Okay? Boys are affected 5 times more than girls. Why? Not injuries. No. Because, who said that? Not slower growth, greater growth. Greater growth. Why? If my jaw is here, how many boys grow taller than girls? Just about all of them, right? That means your jaws are going to grow faster and bigger than the ladies, right? If your jaw is stuck, like we showed in the picture, you're not going anywhere. So which way is it going to grow? Backward. If it grows backward, what happens? Constant pressure, or irritation rather, causes the Tourette's to happen. So girls don't have that as much as boys because their growth is not as great as the boys. Greater growth, greater irritation. Greater irritation, more chance of having Tourette's. Twice as likely in Hispanics and non-Hispanics versus non-Hispanic whites, and more as in black people. Why do you think that would happen? Give that man a prize. What do Hispanics and blacks have more than non-Hispanic whites? They have bimaxillary protrusion. Bimaxillary protrusion has more of a angular development, which means their jaws are able to slide forward and greater growth is not hindered. Whereas Caucasian or non-Hispanic whites are more mesiocephalic. Their jaws cannot grow. So which way does it grow? It grows backward. Mesiocephalic versus bimaxillary protrusion. I use these people because they knew, you guys know these people a little more. In twins, why do identical twins have higher incidence of Tourette's than non-identical twins? Come on, people. This is good stuff. Twins come from what? They are same zygote, right? Same cell, same one zygote, just split in two, becomes identical. So what's going to happen to their growth pattern? They're going to be the same. Whereas fraternal twins, two different zygotes. Two different zygotes means two different growth patterns, two different kids. So their growth patterns are going to be different. So 88% of identical twins are going to have, if they have Tourette's, they're going to have Tourette's, both of them, versus only 20% of those who are non-identical. Because there's two separate embryos. It's just logic. Think. You want to walk on water. You want to walk on water, you got to do what? If you always think inside the box, you're always going to get what's inside the box. You got to think outside the box. Identical twins will have it more versus non-identical twins. They tell you that it's a genetic disease. They spent $80 million on this first one. It's called Slick Track 1. And then they spent a bunch of money on chromosome 22q11, 18q22, SAPAP3, Slick Slice 6A3, BDBD9, and then the latest one was at Yale University was L-histidine decarboxylase. All of them have failed. Why? The reason is because they only take it from one family. This Slick Track 1, the first one, that was done on one Italian family in Italy that had 8 people out of 11 people. 8 of them had Tourette's. They found that Slick Track 1 was the answer. So they spent millions and millions of dollars pouring into that, and yet they couldn't find it in Asian population, couldn't find it in the African community population, couldn't find it in the Asian community, and they couldn't find it in the Hispanic community. Millions of dollars wasted. Neural behaviors, attention deficit, behavioral conduct, anxiety problems, depression, autism spectrum. That one I'm looking into. Learning disability. They can't keep track. If you shake your head every 5 seconds, every 10 seconds, guess what happens to your reading ability? It's tough for you to read. Tics and dystonia are pretty much the shared area. Okay? So they are pretty much a constant, as we showed this morning. Tics, the one doctor asked the question, Dr. Jankovic. He answered it in his answer. The peripheral trauma is increased and recognized as a cause of dystonia. If dystonia and tics are the same place, guess where that would be from? What nerve do you think that would come from? Anybody? We went over this. Sneezing, you got to blink. You got to make a facial grimace. Same with Tourette's. Head shaking, same with Tourette's. Shoulder shrugging, same with Tourette's. Vocal sounds, same with Tourette's. Premonitory urge, same with Tourette's. Sleep disorders, we went over that this morning. 80% of Tourette syndrome have sleep disorders. Retrognathic jaw means less air. Less air means distalized mandible. Open the mandible, increase oxygen, better sleep. Tourette syndrome, pilot study. This is my article. This is the definitive article on it. And you can read it. It's in Cranio magazine.
My name is Ernesto Prischke. I have Tourette syndrome. And I saw Dr. James on his website. And these patients were moving exactly the way exactly the way I do here with the help of my family. My family they were thinking maybe they're actors, maybe those guys on the video are actors. This is very painful, and there's many sicknesses associated with this. This is not just the only comfort. Sweat a lot because of constantly working out in between.
My name's Wade. Came up to the inductions about my Tourette's. 25 now. The symptoms came up around 13 or 14 with the mild facial tics. Nothing too severe. My right arm tends to flex, and my midriff on the right side tends to flex. We saw a reduction in tics in the office from 77 in 3 minutes to 3 ticks in 4 minutes with no vocal ticks, which was one of the biggest ones I was trying to get rid of. We're ironing out the last ones, but it seems to be doing everything we got right from doing this. Better results than we really expected.
I'm Sam. I've had Tourette syndrome since about, my whole life, but started developing tics when I was 6. I used to blink. We thought I just had something wrong with my eyes, and my tics have gotten worse pretty much every year since I was 6. And it makes me emotional right now, just because I lived in pain for the last 6 years of my life. But enough.
Yours one.
And now with the mouthpiece, it's a little hard to talk, but I have almost no urge to tick. I feel like I can breathe better. And it's just, I haven't felt this way in a long time. Yeah, in my neck I have no urge at all. I used to feel like someone was pushing down my spine, and there wasn't enough room, and I needed to pull it apart, and now it's gone.
Noah started with symptoms around the age of 3. He would tick often, different times throughout the year, progressively got worse. He, at age 11, was officially diagnosed after many doctors, many neurologists, trying to figure out what the problem is. they put him on multiple different medicines, and we didn't like the fact that it would change who he was, changed his personality. Just he didn't feel good, and we didn't want to go that route anymore. We took him off of everything, and of course the tics were terrible. And we were told about Dr. Sims, and it has been a miracle. He went from having 70 tics in 3 minutes down to 1. So it has been an answer for us. It's been amazing, and we're grateful.
And we watched some YouTube videos on YouTube with Dr. Sims. That's how we decided to come down as, basically we're living what we saw in the YouTube videos. It's absolutely true, and it's amazing because it seems so simple that, we should have been doing this years ago. It's just something, the simplest thing that Dr. Sims has discovered.
I like how it feels. The way it feels is my favorite part. The eliminates almost all my things.
You don't feel the need to, right?
There's not really there.
This is the calmest I think we've seen in 13 years.
Hi, my name's Darren, and I have Tourette syndrome. It was been a while. It started showing up when I was 7. But then I got diagnosed when I was in junior high school at the age of 14. I tried medications. I tried everything. The only thing medication did was make me like a zombie. I tried, different doctors. My condition actually got worse. But got introduced to Dr. Sims. And he sort of kind of helped me. He actually helped me out. And he actually stopped it. Figured out a way to stop the condition. Almost stopped. My tics have gotten better, as you will see later on in the video.
What was one of the things that we noticed?
With the appliance, it seemed like my eyesight gets on better. And I had the worst case of Tourette's.
How many hospitals and doctors approximately have you seen? Approximately.
Lifetime, like close to 40 doctors.
And their assessment was pretty much the same.
Yeah. God is awesome, and God used Dr. Sims, not just